Well, good morning, everyone. It's March 23rd, certainly a new day. I'm super excited about today's session because we get to hear directly from some of our students and how it's affecting them. And that is the whole reason that we're here. So I'm super excited about that. I need to do my normal house cleaning items. Number one, try to do me a favor and keep yourself on mute if you are not part of the presentation. Same thing with video. Unless you're one of our presenters, please keep your video off. There will be questions that happen in the chat window, so keep an eye on the chat window and you'll see questions and answers happening in there, and there's a lot of discussion. If you have questions specifically for our presenters today, hold them till the end and we'll ask for the questions at the end of all the presentations, and then we'll have both our students, Sonya and myself, jump in and answer as many of those questions as we can. So with that, I'm going to hand off the baton to our president, Sonya Christian.
Well, good afternoon, everyone. And I'm super thrilled to see our first panel with students. In fact, we have another panel on Thursday with students as well, and they're going to be participating in the chat window, answering your questions in the back channel conversation. Feel free to use social media to get across some key ideas that might come across and that resonate with you, because we are in this together in a very unusual time, certainly for Bakersfield College, certainly for California, the United States, and the world. So words like novel coronavirus, COVID-19, quarantine, social distancing, shelter in place, stay at home, have all become part of our day-to-day language. We have come to know Dr. Anthony Fauci pretty intimately because he is there on television, on radio, giving us insights in how we can do our parts in dealing with the rapid spread of this epidemic. Going on to the next slide, you know, the numbers here are rapidly rising. We are over 250,000, fast approaching 500,000 worldwide. And United States is number 3 in terms of countries that have totally tested positive cases of COVID-19. And the most recent number from Kern County is we have 12 cases now in Kern County. You're also aware that Governor Gavin Newsom declared a stay-at-home order or a shelter-in-place order. But we at BC have truly been ahead of the curve, anticipating mostly because of our science faculty and also watching the news. We've been anticipating and preparing to the best of our ability. In the next slide, it's my usual slide where I think the message we're getting from the experts is to bend the curve of the epidemic, to bend it from a very steep rise indicated by the red shade into a much gentler rise indicated by the blue shade on this graph by using protective measures so we do not overrun the capacity of our healthcare system. And certainly starting in February, we put into place cancellation of events and large gatherings to now completely being remote in our instruction and student affairs. So in the next slide, what I have for you is the dashboard from Johns Hopkins, which is where I'm getting my daily number update that I include in the Renegade Roundup. Moving to the next slide, Here again is an in-depth look at what is happening in Kern County. We still have 292 pending tests that we have to hear from. Next slide. So at BC, moving to the next slide, you will see that the phrase I'm rolling out this week to signal the community and what we've been doing is by using the phrase playing where the puck is going to be. Many of you probably know Wayne Gretzky. I should have noted who the hockey player is, but I was introduced to him when we opened up a Memorial Stadium to have in December ice hockey, which was an amazing phenomenon, but that's how I was introduced to Wayne Gretzky. And he described a good player is someone who knows where to play where the puck is. But the great player is one who plays where the puck is going to be. And that certainly describes what the faculty and staff have been doing, students, in preparing to continue with your learning environment. We've been anticipating where the puck was going to be in our planning, which started in January, when our first communication went out from Dr. Nikki Damania and our health center. In January, we started watching this virus, the novel coronavirus. In February, we activated our incident command team and we went to work. We went to work by canceling events. We went to work by getting professional development for our faculty and staff to think about what it would look like to teach online. And we moved not only instruction, but student affairs. Our first wave of classes completed their move by March 12th. And moving on to the next slide, you will see that we were completely online at the beginning of last week. So Shannon, moving on to the next slide. There was one more slide there that I have some more dates, but we may have skipped that. This particular slide is sort of to let our students know and our community know that we're not novices when it comes to distance learning. We have kept pace with the state of California represented with the gray line, at BC represented by the renegade red line. But if you look at the percentage, you can see that over 80% of our classes were face-to-face. So over 80% of our enrollment students, you were in face-to-face classes. And you moved from face-to-face in a completely online format. We have our SGA president, who's a computer science major. You're going to hear from Samantha Polito. And we had her video out today on social media. You'll be hearing from Josiah, a biology major, or Catherine, who is a history major, and Robin, who is a registered nursing major. And I know a lot of our RN students right now are dealing with the enormity of what it means to be a healthcare worker when you're on the front lines of dealing with an epidemic as serious as the one we're dealing with. Moving to the next slide. So we've all been reading, and I certainly have been doing my share of reading. And this particular article on NPR, I came across it because Manny Matsanos, who is our dean responsible for performing arts, and he forwarded an email from a faculty member, Chris Tyner, who was sharing with his colleagues this article on pedagogy online, renamed as, is it Panic plus Pedagogy for Panic-gogy? Is that what we need to be calling it? But there are some great words of wisdom here, because in the entry sentence, what it talks about is think about our students. Our students are moving online. They have issues from not having a laptop to internet access. And, we have solutions, but to keep pace with 40,000 students is not a trivial task. And our students have been amazing. To mental health issues, to financial needs, to issues of their family members losing their jobs, family members getting sick. So Robin DeRosa from Plymouth State University talks about the idea that we really need to include students in this process of rethinking education for a challenging time. It's a new day. And what worked in a face-to-face situation may not work in this situation. So pull in students as your partners. And then Sean Michael Morris from the University of Colorado in Denver talks about providing critical compassion when we're working in this kind of a situation where classes have gone online so quickly in the middle of a pandemic. Next slide. So come back tomorrow, same time, 3 p.m.